I'm a recent graduate of the University of Nebraska. I live in Washington, D.C. now, working as a patient advocate. I'm an incoming Master's of Public Health student at Vanderbilt University. Growing up, I didn't face too many challenges with hemophilia. It did teach me to be cautious, though. I was able to remain active, and while I wasn't able to participate in sports like hockey or tackle football, I was able to find alternatives, such as ultimate frisbee. I like to stay active in the gym. I enjoy hiking. I love going on long walks, especially being in DC. Big hobby of mine is going to thrift stores and finding vintage t-shirts. And I'm a big fan of music too. I've been playing the guitar since I was in 2nd grade. I've been on prophylactic treatment for as long as I can remember. Growing up, it was always part of my routine. In 2021, I switched to a factor mimetic treatment, and overall, it was helpful, but I noticed that I was still having breakthrough bleeds and still having to supplement with factor fairly regularly. I would suggest to anyone considering switching treatment to talk to your doctor like I did and find the treatment that works best for you. I was interested in being on a single product and it needed to be factor. I first learned about ALTUVIIO just from being involved in the hemophilia community. The possibility of higher factor levels for longer really interested me. When I went to my doctor for my annual comprehensive clinic visit, we were actually on the same page. I was planning on bringing it up with him and he was planning on bringing it up with me. ALTUVIIO could keep my factor levels higher for multiple days per week, and I might not need to supplement with a second product for breakthrough bleeding anymore. My doctor and I discussed the possible side effects of ALTUVIIO, which include headache and joint pain. I'm happy to be on one product, and the coverage that it gives me is key to doing the things I love and staying active in the gym. With ALTUVIIO, I have a consistent dose every Wednesday, and that's that. I felt very well supported by my core manager. I have met with her many times, and in those conversations, she has always been helpful and reassuring. And in general, really helped ease that transition. If there's a moral or a motto that I live by as it relates to my journey with hemophilia, it's that you are your own best advocate. Treatments are not one size fits all, and it's important to find the one that works best for you. Everybody's experience with their bleeding disorder is different, and as someone who's fairly active, I found a treatment that works for me. One that provides effective bleed protection, longer half-life, and reduces the risk of bleeds. I'm being compensated to share my story with you in this video.
Indication: ALTUVIIO antihemophilic factor recombinant Fc VWF X10 fusion protein EHTL is an injectable medicine that is used to control and reduce the number of bleeding episodes in people with hemophilia A, congenital factor VIII deficiency. Your healthcare provider may give you ALTUVIIO when you have surgery. Important safety information. What is the most important information I need to know about ALTUVIIO? Do not attempt to give yourself an injection unless you have been taught how by your healthcare provider or hemophilia center. You must carefully follow your healthcare provider's instructions regarding the dose and schedule for injecting ALTUVIIO so that your treatment will work best for you. Who should not use ALTUVIIO? You should not use ALTUVIIO if you have had an allergic reaction to it in the past. What should I tell my healthcare provider before using ALTUVIIO? Tell your healthcare provider if you have had any medical problems, take any medications, including prescription and non-prescription medicines, supplements, or herbal medicines, are breastfeeding, or are pregnant or planning to become pregnant. What are the possible side effects of ALTUVIIO? You can have an allergic reaction to ALTUVIIO. Call your healthcare provider or emergency department right away if you have any of the following symptoms: difficulty breathing, chest tightness, swelling of the face, rash, or hives. Your body can also make antibodies called inhibitors against ALTUVIIO. This can stop ALTUVIIO from working properly. Your healthcare provider may give you blood tests to check for inhibitors. The common side effects of ALTUVIIO are headache and joint pain. These are not the only possible side effects of ALTUVIIO. Tell your healthcare provider about any side effect that bothers you or does not go away. Please see full prescribing information.